Good morning. I'm Dr. Sadia Ghazi, lead educator in physician communication here at Loyola, and I'm here to continue our communication curriculum. Today we will be talking about how to change monologue to dialogue. This is block 7. Let's recall the tips we talked about to overcome health literacy challenges in our last presentation. We should speak in a 4th to 6th grade literacy level with our patients. We should remember that stressful times reduces a patient's ability to understand. We should speak in a slow and deliberate manner, pause frequently, assess the patient's understanding as we speak, use plain language, avoid medical jargon, limit new information to 1 to 3 items at a time. And of course, avoid long monologues. We should change it into dialogue. Allow me to read this sample monologue. This may sound familiar to you because as physicians, we tend to sound like this. When you go home, you'll be taking the same antibiotic for your cellulitis that you've been receiving by vein, only by mouth. It's important for you to take the antibiotic called Keflex 4 times a day. I know it's hard to do, but if you don't, you'll risk getting the infection back or getting a resistant bug, and that would mean your infection would be worse. You also need to care for your wound. You have to do daily dressing changes. We're going to send a nurse home to help you, but you'll need to do some of this by yourself as well. And also make sure to follow up with your primary care provider in the next week. Do you have any questions? That's a lot of information for a patient to download. And a lot of information all at once leaves our patients confused. How do you think a patient reacts when they hear monologues like this? How much information do you think a patient actually understands about what they're being treated for? Do you think the patient knows what they need to do when they go home? Do you think the patient felt welcome to ask any questions? Questions? Be aware, binary questions gives an impression that you don't want to be asked a question. So instead of asking a yes/no question like, do you have any questions? Consider saying, what questions do you have? Patients will often say that they understand something, even though they don't, because they do not want to look ignorant or uninformed in front of their doctors. Never assume your patient understood what you said. Always have dialogue. So let's change our monologue to dialogue. Let's use the chunk and check method. If you wanted to eat a pineapple, you would never swallow the entire pineapple whole, would you? You would cut it down into small, bite-sized pieces and eat it piece by piece. Similarly, when you're sharing information with your patients, we need to break down that information into small bits of information and then check in with the patient after each bit is shared. Let's refer back to our monologue. What are the chunks of information that we are trying to share with the patient? Chunk 1, we want to tell them that they have cellulitis. Chunk 2 are instructions on antibiotics. Chunk 3 is wound care. Chunk 4 is sending a nurse home to help them. And chunk 5 is following up with a primary care provider. Now, how can we use these chunks to create a dialogue? Let's talk about ART loops. ART, ART stands for Ask the patient's perspective, respond with empathy or affirmation, and then tell your perspective. Think of the chunks of information from the previous slide. How can we turn them into questions? Chunk 1 was talking about the cellulitis. So we can ask our patient, what do you know about the infection you have? Let them give your response, let them give their response, and then you would respond with some sort of empathy or affirmation, and then tell them a little more information. That is one art loop. Let's move on to chunk 2, which talked about antibiotic instructions. How can we change this into a question? Let's ask them, have you ever used Keflex before? Let them tell you their answer. You would respond and then tell them more information. That's another art loop. Chunk 3 similarly was on wound care. Again, ask them a question about this. Get their response, respond, and then tell them some more information, and that would be a third art loop. And you would continue these art loops until all your information is shared. Now let's read a new script. How has our monologue changed to dialogue? What do you know about the infection you have?
I think you told me I have an infection on my skin.
That's correct. You have what we call cellulitis. That's an infection of the skin. We need to treat you with antibiotics. Have you ever used Keflex before?
I think I've heard of it before.
Oh, that's great. You're going to be taking that 4 times a day. Now remember, it's very important to follow the directions when you take these medicines. If you don't, the infection might get worse. I want to talk to you about your wound care. Have you been able to see how the nurses change your wound dressing?
Yeah, I have. They have been changing it every single day.
That's right. You need to continue changing the dressing every day at home. We're going to send a nurse to your home to help you with this. I believe your primary care physician is Dr. Ma. Is that right?
Yes, we have been seeing her for many years.
Awesome. I need to make sure you see Dr. Ma in the next 1 to 2 weeks to make sure your wound is healing the right way. So you have witnessed how we successfully changed monologue to dialogue. Now it's your chance to give it a try. Whenever you want to explain something to a patient, remember to give them bits of information at a time. Stop yourself and remember to ask a question whenever you introduce each bit of information. Once you've tried this a few times, you're going to see how easy it is. Good luck, and I hope you enjoy good dialogue with your patients.